Lines and wrinkles. The second main part of ACULIFT treatment addresses the problems of fine lines and wrinkles. These become evident in most areas of the face as we get older, but can also be caused by excess sun and environmental conditions. The technique we use for dealing with these areas is to use acupuncture needles directly into the line or wrinkle. This action creates a very small wound to the face, which the body then endeavors to repair. As it does this, the body produces natural collagen and wound healing properties which fill out the line. And with continued treatment, the line or wrinkle should gradually fade. This same technique can also be successfully employed on age spots and old acne scars. In fact, any area of the face that requires collagen induction will benefit from the insertion of acupuncture needles into the area. We are sure that as your practice and the use of ACULIFT advances, both you and your patients will be amazed at the results that can be achieved. Remember, however, that this is not a treatment that garners immediate results. A course of treatment is necessary with regular maintenance. This will give your patients long-term sustainable results which have been achieved totally naturally. What could be better than that? Treating lines and wrinkles on the face using ACULIFT is an effective part of the protocol and one that should give good results after a minimum of 3 treatments. The same intradermal needling technique can be used on the forehead lines and also areas such as the nasolabial fold, which runs from the side of the nose to the corner of the mouth. The nasolabial fold, along with the number 11s, or the lines between the eyes and the bridge of the nose, are 2 of the most commonly requested areas of the face that we are asked to treat. Known as glabellar frown lines, the number 11s are formed by the movement of the underlying procerus and corrugator supercilii muscles. Sun exposure and genetics are a cause, along with too much frowning. This may sound odd, but many of us have jobs that involve staring at a computer screen all day. And even the fine needling we perform as acupuncturists requires a lot of concentration. Of course, we all grow older, and as we do, the collagen and elastin production in our skin reduces. Other areas that benefit from treatment can be the crow's feet lines around the eyes, although we prefer to call them the starburst lines. And of course, the lines that appear across the forehead can be especially deep on some patients, depending on their exposure to the sun and the elements. From our experience, it is possible to make a difference to any of these areas using ACULIFT, but obviously some parts of the face will respond better than others. If the line is particularly deep, it may take a lot more than 3 treatments to have any profound effect. Having said that, providing you and your patient are prepared to work on the area over a course of time, you will start to see some quite dramatic results. Obviously, the aging process plays a huge part in getting wrinkles. But why is this? As we age, our facial bone structure starts to shrink. Couple this with the loss of collagen and elasticity in the face. Add in gravity, and what we have as a result are wrinkles. Genetics are always going to be a factor in how we age, but there are many external factors that contribute to the speed at which this happens. A major cause of wrinkles that we often come across is, of course, sun damage. This was highlighted in a 2010 study which examined the skin of participants who had been exposed to the sun for a large proportion of their life through a nearby window due to their occupation or activities. Significant differences were observed in clinical scores for wrinkles. Skin roughness assessed by fringe projection on the cheek, and skin heterogeneity assessed with spectrocolorimetry on the cheekbone. Other differences were observed for skin hydration as well as skin laxity, which tended towards significance. The sun will affect people in varying ways depending on the amount of melanin that they have in their skin. Smoking is a well-known major factor that causes wrinkles on the face, and it can be very evident on the top lip of those who have smoked for a number of years. It is, however, not solely the repetitive action of smoking that adds to the lines and wrinkles, but what the cigarette is doing to the body and the pollutants in tobacco smoke. An interesting study carried out in 2004 was the first to examine whether there was an earlier need for cosmetic surgery in smokers. A questionnaire was sent to 517 patients who had undergone blepharoplasty or upper eyelid correction due to valid dermatochalasis or baggy eyes. The smokers underwent surgery an average of 3.7 years earlier than the ex-smokers and 3.5 years earlier than the never smokers. Ideally, if our patient has made the decision to stop smoking and would like us to help, we will work with them using traditional acupuncture before commencing with a course of ACULIFT. It is so often overlooked, but one of the top 10 anti-aging tips is simply to drink enough water. Loss of hydration can affect the skin in many ways, such as flakiness, tightness, and dryness. Dry skin is particularly more prone to fine lines and wrinkles. Drinking sufficient water is also important for removal of waste from the body. If the volume of fluid is decreased, then the body finds it much more difficult to remove toxins. This can result in the body attempting to expel them through the skin, which can in turn exacerbate conditions such as eczema and acne. We always recommend that our patients maintain an adequate intake of water throughout the day. So, how much is adequate? The recommended daily amount of water is 8 glasses a day, but that has been subject to a lot of criticism. As with everything, we are all unique and different people may require varying levels of water depending on the local climate, activity, type of job, age, sex, weight, food intake, and alcohol, and so on. We are able to use the information derived from the initial consultation to establish whether a couple more glasses a day may benefit our patient's health and their skin. One suggestion could be that your patient drinks enough to ensure that their urine is mostly clear. A distiller in your clinic is preferable to tap water, so the quality of water is important to think about too. As acupuncturists, looking at our patient's diet and lifestyle will already be integral, and these skills can be incorporated into your cosmetic treatments, ensuring we are always working from the inside out. So, we have looked at the potential causes and how we can help to prevent deep lines and wrinkles forming. However, we will now concentrate on the method for needling the lines and wrinkles that our patients are looking for us to treat. Treating wrinkles should give good results after a minimum of 3 treatments. Same intradermal needling technique used on the forehead lines and nasolabial fold, which runs from the side of the nose to the corner of the mouth. The nasolabial fold, along with the number 11s, are most commonly requested areas we are asked to treat. Needle 6 mm intradermal technique. We will be using tweezers to insert, as we did for the 3 eyebrow points. Remove the intradermal needle from its individual packaging with tweezers. You will need to practice holding intradermals with tweezers. When appropriate number of intradermals have been inserted into target line, they need to be left in position for 20 minutes. During this time, a redness or erythema will appear around needled area. This shows us that treatment is working. When you remove intradermals with tweezers, have a cotton bud on standby to help extract the needle. Sometimes you will find that intradermals tend to grab the skin, and you will need to put a little pressure at the base of the needle to help with removal. By doing this, you will also help to prevent bruising. You will see some improvement after a minimum of 3 treatments. A course of 10 treatments is recommended for optimum results, followed by maintenance treatments every few months. This will help to prolong effects of initial treatments and ensure fine lines and wrinkles remain diminished. Number 11s. Begin with the lines in between the eyebrows at the bridge of the nose. Look at one of the lines that you want to needle. You will need to open the line up by using 2 fingers of the opposite hand that you are needling with. We want to insert the needle into the base of the line. If you visualize the line or wrinkle as a narrow canyon, the needle needs to go right into the bottom of the canyon. Insert the intradermal needles at a 45-degree angle to the skin. The needles should be spaced at about 2 mm intervals. The direction of the needle is not overly important, but on these number 11s, we still try to work in an upward direction. If we are looking at a line approximately 2.5 centimeters in length, we should be trying to insert at least 10 intradermals. The needle should be inserted to a depth that is comfortable to the patient. This need not be the full depth of the needle shaft. However, try to maintain the 45-degree angle as you needle. Forehead. Again, you will need to insert your needles at a spacing of 2 mm and work across the line from one end to the other. This is one of the rare occasions when we are not needling in an upward direction. When needling the forehead lines, we are attempting to insert as much of the intradermal needle shaft into the skin and along the line as possible. Aim to maintain a 45-degree angle from the forehead as you needle. Be patient. The more intradermals you can insert into the line, the better the overall outcome. Nasolabial fold. The nasolabial fold between the corner of the mouth and the side of the nose can be treated in exactly the same way. Again, make sure that the line is opened up so that you can needle directly into the base of it. Practice opening the line with the forefinger and thumb of one hand as you needle with the other. This makes the insertion of the intradermals a lot easier than when the skin is loose. Spacing of the intradermal needles should be approximately 2 mm apart, and again we would needle in an upward direction. Crow's feet. When working around the eyes, we need to take extra care as this area can be very sensitive and we do not want to needle too close to the eye. From experience, if there is any chance of bruising, this is the most likely area where it will happen. If you do bruise the patient, do not panic. Have some arnica cream on hand and apply this to the skin as soon as the bruise appears. Using your usual technique of opening up the line with one hand, insert the intradermal needle gently into the line around the eye. As always, try to maintain a 45-degree angle from the skin and insert the needles towards the eye. Top lip. This is another area that is very popular for treatment. Patients very often complain about the lines that appear here, which, as we discussed earlier, are often but not always caused by smoking. Using the intradermal needles is a very effective way of addressing these lines, but this area can be particularly sensitive. The anesthetic points that we have needled should be sufficient, but if a lot of work is required in this area, it may be appropriate to apply the anesthetic cream before you commence the protocol to assist with this. After needling the top lip area, you can then take a little more time to address any other fine lines and wrinkles, such as those on the chin and across the bridge of the nose. How intradermal needling works. The action of using the intradermal needles is twofold. First, by inserting the needle, we are creating a very small injury to the skin. The body then produces collagen that repairs this injury, and due to the location of the needle insertion, this will start to fill out the line. Second, we have created a number of small perforations in the skin along the line that we are treating. These perforations will remain open for a short while, which will give us the opportunity to apply skin rejuvenating serums and moisturizers that will be absorbed into the upper layers of the dermis. Remove all of the needles inserted from the steps that we have mentioned in reverse to the order they were inserted. Use the tweezers to remove the intradermal needles and gently press down on the skin with a cotton bud as you remove each one to prevent bruising. Retain the needles in the hands, arms, feet, and legs. This will be removed at the end of the treatment. We now have a small window of time to apply any serums or moisturizers to the area in order to maximize the benefits of the treatment. This will be absorbed into the skin in the area that you have needled and aid in the skin's rejuvenation process. Of course, there are many serums and moisturizers on the market that all profess to improve the quality of the skin, but our serums of choice would either be a hyaluronic acid serum with pantothenic acid or vitamin B5 and or a retinol serum. These are applied with a dropper and are concentrated, so they need to be used sparingly and gently massaged into the face following treatment. Allow the serums to sink into the skin before moving on to the next step. Hyaluronic acid. This sounds like the last thing you would want to administer to a patient's face, but it is actually extremely gentle and is naturally present in the skin as part of the extracellular matrix and as a component of collagen. It also acts as a ground substance of the dermis and is also a component of joint fluid, vitreous of the eye, disc nucleus, and the umbilical cord. One of the most significant properties of hyaluronic acid is its capacity to bind huge amounts of water, which is 1,000-fold of its own weight. As this is a natural molecule which decreases as we age, it is one of the reasons that the skin becomes dry and joints stiffen. Applying this to the face after needling greatly improves absorption and allows the hyaluronic acid to penetrate the dermis more deeply. Due to its massive hydrating capacity, this in turn provides additional moisture which works to plump and smooth out the wrinkles. Pantothenic acid is also known as vitamin B5 and is often found alongside hyaluronic acid in readily available serums for external use. This water-soluble vitamin is one of the three components of coenzyme A occurring naturally in the body. Dr. Lit Hung Leung investigated vitamin B5 for the treatment of acne vulgaris. Participants were asked to take an extremely high dose daily and also apply a topical solution which contained pantothenic acid. Within only 2 to 3 days, there was a visible reduction in facial sebum secretion and the condition was found to be under control after 8 weeks. The other facial benefit was the shrinking pores. The pore size becomes noticeably smaller within 1 to 2 weeks, very often much sooner. Like sebum excretion, the pores will continue to shrink until the skin becomes much finer, giving the patient a much more beautiful skin. This study demonstrates the beneficial effects of pantothenic acid for acne sufferers, and although we are only applying it topically, vitamin B5 will still have a beneficial effect on the patient's skin. We discussed how we are making very tiny injuries when we needle the skin, which will encourage collagen induction to plump the wrinkles. Pantothenic acid is widely known for its wound healing properties, as it aids in the production of the lipoproteins of the skin, hastening its healing time. This is why we choose to apply this vitamin as part of a serum that contains hyaluronic acid. After all of the intradermal needling we have carried out, this acts as a natural hydrating and healing part of the treatment. Also known as vitamin A, retinol has some key functions in the body relating to embryology and vision through to immunity. Aside from these important roles, it is well known as an active ingredient in skin creams and serums. A 2007 randomized double-blind vehicle-controlled study evaluated the effectiveness of topical retinol in improving naturally aged skin. Topical retinol improves fine wrinkles associated with natural aging. Significant induction of glycosaminoglycan, which is known to retain substantial water and increased collagen production, are most likely responsible for wrinkle effacement. A biologically active cosmeceutical such as all-trans retinol containing 0.3% retinol is recommended and needs to be applied sparingly. While vitamin A is important to the body, it can be toxic in high doses and can also have a drying effect. So, if using retinol, you may want to include hyaluronic acid serum to lock in the moisture. Note: ACULIFT is contraindicated for patients actively trying for a baby, pregnant, or breastfeeding. And retinol should not be applied in any of these cases. Vitamin A is also not recommended for patients undergoing skin peeling procedures or taking medication prescribed for acne. Thank you very much for listening.